is Janine and I am 44 and I have two small children, two boys, 7 and 5. And last June in 2020, I found a lump. Just randomly, my hand went to my breast one day and I found a lump. And I told myself it was probably nothing, just hormone related. So I decided with most things, if I have an ache and pain, I'll leave it 2 weeks and then I'll go and get it checked out. Well, 2 weeks passed and it hadn't gone. And so I decided to go to the GP. It was pretty tough to make that first phone call, to be honest. I could barely even say my name. But the receptionist was very reassuring and said, most lumps are nothing, come along and see the lovely lady GP. So I did. And she felt it and said, oh, that's nothing to worry about. That's just a cyst. And I said, are you sure? And she said, yes, it's round and smooth and movable. Definitely a cyst. Don't worry, but I'm going to send you to the breast clinic just in case. So I went home pretty reassured, thinking this is fine, I'm going to be fine. And the day of appointment came. So I went by myself to the breast clinic thinking it's just a cyst. What could possibly go wrong? The consultant felt it and said, yep, that's definitely just a cyst. Let's pop you in the mammogram machine just to make sure. I had the mammogram. I went back to the waiting room. Then I was called back in for another mammogram. And I think that was the first point I realised maybe this isn't actually a cyst. And then I was called into the ultrasound room. And before I even got on the bed, I could see by the look on the technician's face, eyes only, because she had a mask on. And I said, that's not a cyst, is it? And she said, I don't think it's a cyst. No, we need to take a look. That was probably the worst moment of my life. She told me right there and then, she thought, I have cancer. They did multiple biopsies on 2 spots in my breast. And it was the day before my son turned 6. So they tip you out with a blue book saying all about having cancer. And they expect you just to go home and wait for a week while they're processing all the results of the biopsy. But they had already told me I have cancer. And so the next week was absolute hell because I didn't know if the cancer was in my lymph nodes, if it had spread, if I was going to die, if my son's 6th birthday would be the last one I ever saw. And then it was just a whirlwind of appointments. Luckily for me, it was not in my lymph nodes. But due to the type of cancer that I had, it's called HER2 positive. I needed chemo. And there were 2 spots of it in my breast, one big lump and some other little cells that were going to be big lumps. So I started on chemo. About 3 weeks later, I had 6 rounds of chemo, 2 different drugs, EC, which is epirubicin, and cyclophosphamide. And then I had 3 docetaxel with Herceptin, and I am still on Herceptin now until January. So that would be 18 months of treatment in total. In January 2021, I had a Diet flap reconstruction where they take your tummy, they basically hollow out your boob and they put tummy fat in. The chemo took my fertility. I lost my hair. And it's been a tough journey. But I'm coming out the other side now, just about. One of the things that was really difficult about my cancer journey, if you could call it that, it wasn't a fun one, was that COVID was in the way as well. And that meant that a lot of the things that normally I could have had, I couldn't access. But some of the things also I found, like I used to do spa days with my best friend, and I was gagging for that time with her, but none of the beauty salons will touch you if you're having active cancer treatments. I just desperately needed to relax. And one of the best things that I did eventually get was some sessions through the through the Helen Rollason Cancer Charity. which was some reflexology and massages, which has just been lovely because it's been like an outlet for my emotion. It's very relaxing to be able to have that time. And I attended a Look Good, Feel Better makeup course, which was super helpful because when you've got no eyelashes, no eyebrows and no hair, you need all the help you can get. It would be really good if women could be given access to things that could just help them relax and deal with their anxiety. I think that would be so useful because until you've stood in my shoes, you have no idea.